Hello and welcome to World Insight from Beijing. I'm Tian Wei. We begin today's program once again with the ongoing global battle against the COVID-19. According to the World Health Organization, by Sunday, global cases of novel coronavirus grew by more than 80,000 and fatalities rose by nearly 6,000. The latest epicenter, the United States, President Donald Trump said the week ahead will probably be the toughest. In Europe, experts say signs of hope are emerging as Italy reported its lowest single-day deaths in nearly 3 weeks, and Spain saw continued declines in new cases and deaths. Here in China, the mainland reported 38 new imported cases on Sunday. What is China's strategy in the next phase of the fight? Earlier, I had an in-depth interview with Professor Zhang Wenhong, who is the head of the Center for Infectious Diseases at the Huashan Hospital of Fudan University in Shanghai. He's also the leader of Shanghai's anti-COVID-19 clinical expert team. Let's listen to what his assessment is. Dr. Zhang, I heard you've been telling people that people should enjoy more steaks, eggs, milk as much as possible because they need to survive and thrive even with the pandemic. Is it true?
在目前的疫情期间
Under the current pandemic, many of our friends have returned from overseas, but it has been difficult to fly into China because many flights have been grounded. Unfortunately, some of the people returning from overseas have already been infected. In our analysis of these infected people, I found that those who are prone to suffering from severe symptoms are mainly those with nutritional deficiencies.
跟营养的缺乏有关系。
Many of these people returning from abroad never encountered food shortages, so why did these deficiencies arise? The cause is travel fatigue.
因为旅途的劳累。
During the journey, to best protect themselves, they avoided eating or taking off their masks. So I would like to advise all those traveling to maintain a healthy diet to resist the virus. There is a correlation between the quality of nutrition intake and the speed of disease progression. Especially during the journey back home, nutrition is critical. So I would advise my friends returning to China to eat some steaks before the trip.
出来之前最好在家里先吃2块牛排，把自己的蛋白质补充的比较充分。
Getting their fill of steaks so they will be safer on the road. This safety translates to better resistance because you have more protein to boost your immunity.
Besides steaks and milk, what do you think are some of the most important things we need to do now here in China for the prevention and control?
在中国已经度过了一个非常黑暗的时期，也就是说
China has come out of a very dark period. At present, there are basically no local cases in China. Many cases are imported. In other words, China has now transitioned to the second phase. In the second phase of prevention and control, our approach is mainly to prevent imported cases. The number of imported cases may not necessarily be large, but there is a difference between the second and the first phase.
是跟第一阶段出现了一个不同的一个差异点。
The difference is that there are some people who have been infected with the virus among the people returning to China. Their symptoms are relatively mild, and others are exposed to these cases are at risk of infection. So we have several requirements.
第一个，从国家的层面。
First, on the national level, at customs there are sufficient barriers for imported cases. These techniques include virus screening and quarantining travelers for a limited period of time. For the general public in the second phase, the people are still in the epidemic period, so we must maintain good hygiene habits which are developed during the first phase. That means we still have to maintain a proper social distance. Masks should still be worn in places where people gather. We also need to wash our hands frequently.
尽量还是可以戴口罩，还有勤洗手。
I believe that by doing these 3 things well, we can prevent the second wave of the coronavirus epidemic.
Professor Zhang, one of the things people have been asking, especially from outside China, what exactly are the Chinese ways, or is the Chinese way? But Too many of us who are here in this country know there's no just one single Chinese way of dealing with COVID-19, but various practices. How would you compare, for example, where you are, Shanghai, with the city of Wuhan?
这个问题其实问得非常关键。
This question is actually very critical. Earlier, I participated in a dialogue with scientists from various countries. We also discussed some related issues together. Participants in the dialogue included scientists and doctors from Asian countries such as China, Japan, and South Korea, as well as scientists from the United States, including the famous American virologist David Ho.
当中我就分享了中国的经验。其实中国的经验。
During the dialogue, I shared China's experience. In fact, China's experience cannot be replicated. Take Wuhan and Shanghai, for instance. Both cities are in China, but they have different circumstances.
情况下面，我们采取的方式完全是不同的。
The harsher measures taken by Wuhan were because it was the epicenter in China at that time. The center of the outbreak in the United States is now mainly New York. At areas where the overall number of local transmissions are low, they will have different prevention and control measures that focus on keeping out imported cases. The so-called scientific strategy for the epidemic prevention is calculated based on local conditions, like the habits of the people and the medical facilities.
我们武汉采取的就是 lockdown。为什么要 lockdown？lockdown 就是说这是整个中国的 epicenter。
The lockdown of Wuhan was because it was the center of the outbreak, and there were a large number of cases exported. Therefore, the complete closure of the city at the time would play a very effective role in the national epidemic control, and it would have a great significance for China and the world. This greatly reduced the number of imported cases in Shanghai. After the import ratio has been greatly reduced, Shanghai's prevention and control does not require a lockdown.
上海的防控就不是 lockdown， 我们是 slow down， 甚至于 shut down 都谈不上。
The measures at the time in Shanghai were a slowdown, not even a shutdown. So what does a slowdown mean? We just slowed down the pace of life.
尽量的 stay at home， 尽量的待在家里。
We suggested people stay at home as much as possible, wear masks when going out, wash hands frequently, and maintain social distance. Some entertainment and leisure places, such as restaurants, temporarily closed, but supermarkets, hospitals, banks, and other essential businesses remained
公
open.
共的交通给限制掉了。所以在这种情况下面，对于一个城市的 slow down， 对于
We only restrict public transportation. So in this case, this can slow down a place where the number of cases is not very big, and the local economy and people's lives are not greatly affected. This is somewhat similar to the current epidemic prevention methods adopted by Hong Kong, Singapore, and other places. It blocks the import-type ratio. People's daily grind slows down. If the epidemic flares up, it may have to transition to a shutdown. If it becomes an epidemic center, it may require a lockdown.
成为一个 epicenter， 我们可能就需要 lockdown。
So, Professor Zhang, what you said is extremely interesting to me because there's one ultimate question that is, how would you judge as to what approach to take? Now, when I ask you that, I'm bearing in mind that you are the head of Shanghai's anti-COVID-19 clinical expert team. In other words, you are providing up-to-date information and analysis to the decision makers. So what are some of the numbers you will have to read and some of the most critical factors you will analyze every time when you provide the suggestion, whether it is quote-unquote a lockdown or a slowdown or something else? What about now?
事实上呢，就是我们在疫情的一个发展过程当中。
In fact, there will be some clues during the development of the epidemic. From the perspective of a city like Shanghai, the first phase in the development of the epidemic is imported cases.
如果 imported cases， 我们也就是输入性的一个病例。
At this time, if you can effectively prevent and control imported cases, it will be very successful. However, there may be negligence in the process of this phase. This negligence means that you have guarded the gate, but the small door is unguarded. Like the United States, China was blocked, but it did not notice the cases from European countries. Then came the second phase, and the outbreak in the U.S. suddenly boomed. At this point, the second phase of the outbreak is imminent.
我们给你一个提示，我们得升级，我们得 upgrade
A stricter prevention and control strategy than before is necessary. It is also very difficult
我们要对所有的 imported cases 进行 tracing， 我们进行追踪。你如果追踪得到
because we need to track all imported cases. If it cannot be traced, the epidemic will spread further in the community, or even spread among communities.
另外一个小区里面。
The number of cases will climb slowly at the early stage, and more cases will be difficult to trace later.
直到越来越多的它的 cases 你找不到，这个时候我们对整个城市采取的策略就是逐渐的从 slow down 要过渡到 shut down。所以现在很
At this time, our strategy for the entire city is to gradually transition from slowdown to shutdown. Most countries now adopt shutdown, and even the requirements in some areas are more stringent. For example, in Hong Kong, it is illegal for more than 4 people to eat out together. In Shanghai, we tracked all the imported cases to understand who was in close contact with each case. Luckily, there were no 3rd generation and 4th generation infection cases. I believe that experts from various countries will take corresponding measures according to the situation of their own countries.
我相信各个国家的流行病学专家也根据自己国家的一个情况，会采取相应的 response。
Our exclusive interview with Zhang Wenhong. It's been more than 2 months since Wuhan imposed the lockdown. All public transportation was suspended, commercial flights halted, and residents were urged not to leave their homes. As the lockdown is soon to be lifted and public daily activities return to normal, or at least somewhat normal, many people are concerned about one issue: Wuhan residents' level of immunity. Do they have stronger immune system compared to the people from the rest of the country and the rest of the world regarding COVID-19? I asked that question to Dr. Zhang Wenhong. Wuhan has been locked down for quite some time.
Yes.
It's likely to be open very soon.
Yes.
However, after a city which is the epicenter,
Yes.
with the cases percentage so high and death rate reaching certain extent, what would that mean when people there have been locked down for quite some time? Would the people as a group develop certain kinds of immunity among themselves compared to the other parts of China, compared to the other parts of the world?
Yes, that's right. I think this is really a very crucial question, and I think maybe 1 month ago that Prime Minister from the United Kingdom, he mentioned about the herd immunity. Is that right? Actually, if a city or a country have the herd immunity, really I think it will be a disaster for the population there. However, when emerging infectious disease, I think sometimes it cannot be speculated than we met before. However, I think in Wuhan and something similarly in Italy, we found that lots of patients were infected by the novel virus. And I think if a lot of population infected with this virus, actually they would acquire the immunity. So the herd immunity actually was forced to be set up. So therefore, I think in China, the only city that with the highest immunity, it would be Wuhan. So after a long time, I think the Wuhan may be the most safest city in China. So therefore, I think I can imagine that the Wuhan, lots of people actually they have the immunity already. However, I think this is a scientific question. We should do more study for that. Fortunately, some of my colleagues in Wuhan city, they have designed some study to do that. They can do the several epidemiology study for that. Maybe several weeks later, we can get the level of the antibody to the virus. So today, everything is still remain to be answered.
But then what does that mean for the rest of the country? And what does that mean for the rest of the world when we are interacting with people coming out of Wuhan, which is a city that had been locked down?
我们在评估这个事情。
We are evaluating this matter. Earlier, I discussed this issue with a German virologist. He had a long history of cooperation with Wuhan. He said that it is difficult for us to judge the degree of herd immunity. But he believes during this epidemic, people in Wuhan have become the most immune group in China. From his point of view, when we are in contact with Wuhan's people, we are in contact with a group of immune people.
它的免疫力最强的一个群体，所以在他看来。
I think that if Wuhan has no new COVID-19 infections, it has no local transmissions. This is the first point. The second point is that the population in this city has the highest immunity against COVID-19. Then the premise of these two scientific assumptions is established. I believe that proving this will be inevitable, and a conclusion should be reached soon.
本土的病例，这个是确切的。
Professor Zhang, one thing, if you look at the chart of the cases in the world, it took about 4 months to have 500,000 cases around the world, but only 1 week when it reached 1 million from 500,000. So what does that say to us, Professor Zhang, for the weeks and probably months ahead for all of us, everybody here in the world?
事实上，经过第一阶段的这个对它的一个。
In fact, according to the chart of the increasing number of COVID-19 cases in the first stage, we can calculate the rate of virus transmission. The data now looks relatively high. We must know that the number of people with influenza may reach tens of millions in the world at a time, which paralyzes many people. Many people say that COVID-19 is a serious flu. The flu can reach tens of millions of cases, and COVID-19 is only 1 million. Why should we be afraid of it? But now everyone recognizes that 1 million coronavirus cases and tens of millions of influenza cases can be comparable. The mortality rate of COVID-19 is higher than that of influenza. This 1 million has shocked the world, which can be seen from the current economic malaise across the world.
来讲的风险具有可抵性，所以这个病的100万，事实上已经让世界已经吓得了有点发抖。
In the early 1 or 2 months, some anti-epidemic methods adopted by many countries were insufficient. The number of confirmed cases has shown an exponential rise during the last 2 weeks. A direct result of this exponential rise is that many countries have taken more active prevention and control measures than before, such as the United States, Italy, and Germany. People in these Western countries have even started to wear masks, though they previously lacked this custom. The death of a large number of patients in the previous stage had made them recognize the difference between this disease and some serious flu in the past.
我现在最担心的是什么呢？这些国家
What I am most worried about is that a pandemic already exists. And what results will this cause? Now we have seen cases start to appear in India and some African countries. Only when there is a more severe epidemic in these areas can we really come to grips with a disaster. I think the situation has become very serious so far. Developed countries and some emerging countries, regardless of their current predicament, should unite to help countries and regions with insufficient medical resources to combat the epidemic. If countries with backward medical resources cannot control the epidemic, even if the epidemic in the United States, Europe, and other places is eventually contained, the global situation will remain bleak. So today, 1 million cases are merely a warning for us to unite. Fortunately, many leaders in the world are responding to the epidemic more actively than before. I think that is a good start.
我想这个是我们迈向良好的一个开端。
You talk about the international cooperation, Professor Zhang, but exactly what you meant. I mean, it sounds like a great word, but what is the content of it, particularly now, urgently?
这里面就涉及到很多方面。
International cooperation includes many aspects. Each country has its own strengths, such as China. Our previous experience in epidemic prevention and treatment is valuable, and our medical-related manufacturing industry is good. such as the production of ventilators. These are our strengths. In terms of science, China has also begun to do some advanced research. Meanwhile, European countries and the United States have always been pioneers in science, so that we can conduct comprehensive cooperation and share information in the fields of vaccine development and new drug research. If the world can cooperate on medical supplies, science, drugs, vaccine, and other aspects, we will be able to control the COVID-19. And we must also be fully prepared for a protracted battle against this disease, because the global anti-epidemic process may be quite long.
但是我们也要有充分的准备，这个道路可能会比较漫长。
What exactly is China's exit strategy, quote unquote? Meaning that the country has managed to keep the number quite low, even though there is still danger of imported and asymptomatic. But what is likely to be the process forward to exit from the higher alert and tension, Professor?
中国事实上在这抗疫的过程当中
China will never withdraw from fighting the epidemic before other countries. As I said before, the control of this global epidemic does not depend on the country with the best control or the earliest control, but on the country with the worst control. If there is one country in the world that has not controlled the epidemic well, we cannot isolate this country. We should help it control the epidemic. Because of the nature of the virus, it can spread to the whole world from a single uncontrolled spot.
它就会向全世界蔓延。
And now China still faces challenges. One challenge is the same problem faced by other Asian countries. That is, the persistent imported cases. According to the current rate of increase in global cases, this epidemic will be followed wave by wave, and the period may be longer. China will not withdraw from this protracted war against the epidemic, but its combating strategy will be adjusted. China will further promote the resumption of labor when there are very few local cases, and at the same time, strengthen the management of imported cases. During the first step of epidemic control, we have Wuhan's experience in the epidemic outbreak center and Shanghai's experience in dealing with imported cases. The second step of outbreak control in our country will focus on imported cases. It's just that the time for final victory is not in our own hands, but depends on when the epidemic in the world is completely under control.
时间取决于全世界什么时候完全控制疫情。
It is a globalized world, and the virus does not respect the border at all. But we want to thank you very much, Professor Zhang, for helping us to understand the latest and also provide your direct analysis.
Thank you. It's my pleasure. Thank you.
Thank you so much, Professor.